The honourable member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Health and Wellness. On the South Shore, Lyme disease is a major public health issue. People who don't get treatment in time suffer from post-Lyme disease syndrome, which is characterized by chronic fatigue, pain, and cognitive issues. It can be life-changing and, in many cases, debilitating. Mr. Speaker, we've heard the minister say that the department is following the national guidelines around the assessment and treatment of tick-related Lyme disease, but I'm worried that people without family doctors aren't getting a diagnosis in time. What is the minister doing to ensure that people can get treatment before it's too late?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for raising this question, especially as we proceed into the spring weather, Mr. Speaker. It's important for all Nova Scotians to be aware that, in fact, tick-borne illnesses like Lyme disease are on the rise in Nova Scotia, in a large part due to the warmer climate and the prevalence of the tick, the deer tick, Mr. Speaker. As far as the treatment awareness is number one, Mr. Speaker. Prevention is obviously the best first step. Beyond that, the education and the awareness with our medical professionals to provide that information, to be aware and help follow those guidelines, Mr. Speaker. So all those steps are being taken to help inform and aware Nova Scotians and visitors of the risks, as also how to identify and seek treatment, and then with our frontline healthcare providers, of course, Mr. Speaker, to follow the national guidelines.
The honourable member for Cape Breton Centre.
Mr. Speaker, the number of Lyme disease cases reported in Nova Scotia is on the rise. Last year, there were 326, almost one-third of the number of reported cases in the entire country. Nova Scotia reported the highest incidence in Canada in 2016, 12.7 times higher than the national average. Mr. Speaker, will the minister acknowledge that Lyme disease is a public health care crisis in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As is the case when jurisdictions undertake education initiatives and awareness campaigns, Mr. Speaker, obviously awareness and reported incidents would be expected to be higher. So we recognize that the prevalence and the growth is recognized to be entering and emerging from the Atlantic region, Mr. Speaker, in particular Nova Scotia. So that has a contribution, but also our efforts to build awareness, I think, is a contributing factor as to why we see those numbers so high in Nova Scotia. And I think that just goes to show that we have more work to do. And that's why I'd like to acknowledge the work that our partners like Doctors Nova Scotia with professional development initiatives to help again inform our frontline healthcare providers.